Hey everyone, and welcome. If you're in pharmacy, you know that when it comes to powdered drugs, size is everything. Getting it just right is absolutely critical. So today, we're going to dive into a really key piece of equipment that makes all that precision possible, the air separator. Let's get right into it. So, how in the world does this thing work? Well, the main idea is something you've actually seen a million times. It's called air classification. Just picture it. A gust of wind blows through, picking up all the fine dust and dry leaves, but it leaves the heavier little pebbles right there on the ground. The air separator, it basically just takes that exact same idea and turns it into a super precise scientific tool. And to make sure this is all super clear, here's our game plan. We'll kick things off with the science, the principle behind it. Then we're going to build the machine piece by piece, see how it all works together. And then, this is the important part, we'll talk about why you, in pharmacy, really need to know this stuff. And finally, we'll wrap up with the good, the bad, the final verdict. Okay, first up, let's dig a little deeper into that core principle of separation. It's honestly pretty cool how we can look at something as simple as a breeze and use that idea to engineer a powerful tool that's precise enough for making medicine. Okay, so this is where the real science comes in. It all boils down to this thing called terminal velocity. Basically, every particle has a speed where the force of gravity pulling it down is perfectly balanced by the air pushing it up. Now, tiny, fine particles, they have a low terminal velocity. It doesn't take much air to lift them up and carry them away. But the bigger, coarse particles, they have a high terminal velocity, so gravity pretty much always wins, and they fall right down. That difference, that's the whole secret. All right, so now that we've got the principle down, let's actually look at the machine itself. For this next part, think of it like we're building our very own air separator from the ground up. We're going to look at each key component one by one. First things first, you need power. And in this machine, the fan or blower, well, that's the engine. Its entire job is just to create that constant, steady, upward stream of air that's gonna do all the, well, not the heavy lifting, more like the light lifting. Next up, we've got to get our powder into the machine, right? So it gets fed in through the feed inlet and drops right into the main arena, the classifying chamber. This is where all the action happens. This is where the powder meets the air. But here's the thing. For making pharmaceuticals, just a simple blast of air is nowhere near precise enough. That's where the rotor and vanes come into play. These are spinning parts inside that basically whip the air into a controlled vortex. This gives us incredibly fine-tuned control, making sure that only the particles of the exact size we want get to move on. And what's the result of all this? You get two distinct exits. The tiny, fine particles get carried up and out with the air through the fine particle outlet. Meanwhile, the heavier, coarse particles that couldn't make the trip fall to the bottom and are collected from the coarse particle outlet. See? One input, one process, two very different outputs. It's pretty elegant when you think about it. Okay, so we've built the machine in our heads, and we totally get the principle behind it. Now, let's fire this thing up and watch the whole process in action, from start to finish. It really is just a simple four-step dance. Step 1, feed the powder in. Step 2, the fan creates the lift. Step 3, the air does its thing and separates the fine from the coarse. And step 4, you collect the two piles from their separate exits. Feed, lift, separate, collect. If you remember that, you've got the whole operation down. All right, so let's get to the big question. Why does any of this matter for your career? For you as a future pharmacist? Because look, this isn't just some cool piece of engineering. Understanding how this machine works is so important because it directly impacts how effective a drug is, the quality of the medicine, and, at the end of the day, patient safety. And here's exactly why. Just think about inhalation powders, like for an asthma inhaler. For that medicine to work, the drug particles have to be a specific size. We're talking microscopic. If they're too big, they just get stuck in the back of your throat. If they're too small, you just breathe them right back out. It's the air separator that makes that incredible precision possible, ensuring the medicine actually gets deep into the lungs where it needs to be. So yeah, it's obviously a super important machine in the pharmaceutical world. But like any technology, it's not perfect. It's not the answer to everything. So to really get the full picture, we have to look at both sides of the coin, the advantages and the disadvantages. On the plus side, it's fantastic. It's really efficient, you can run it continuously for huge batches, and the powders it produces are incredibly uniform. And here's a huge bonus, it doesn't generate heat, so it's perfect for those sensitive drugs that can't take the heat. But it has a high price tag to start with, and it uses a ton of power. Also, forget about using it for anything sticky or wet. It just won't work. And it really does take a skilled operator to get that airflow dialed in just right. So here's the bottom line, the main takeaway. For the right kind of powder, an air separator is absolutely unbeatable for creating that perfect, uniform particle size. But you have to remember, it's a specialized tool. It's definitely not a one-size-fits-all solution for every powder you'll ever come across. And that kind of leaves us with a question to think about for the future, doesn't it? We know drug formulations are only getting more complex, and we're going to need to work with materials that are stickier and more difficult to handle. So how can this technology evolve? What kind of cool innovations could help overcome the problems it has now? That's a challenge for the next generation of pharmaceutical scientists, people just like you, to figure out. Thanks so much for watching.